Welcome to today's broadcast. My name is Colleen Patterson, and I'm the Vice President of Employer Services and Compliance at Savoy. Joining me today is my colleague, Sara Simkins, and Sara is a Senior Compliance Specialist here at Savoy. Sara and I are going to be discussing a topic that we think has gotten a lot of attention, certainly in the news, and we both have received a lot of questions about, and that is the transparency and coverage rules. And what we're going to talk about today is, well, what does all of this mean for our broker partners as well as our clients? So we're going to start with really what the premise of the transparency and coverage rule is, and that is that it was designed to help patients know how much their healthcare will cost in advance of treatment. So beginning on July 1st, 2022, the transparency and coverage rule, it requires all size employers. So that means fully insured as well as self-insured, and that includes level funded plans, as well as health insurance issuers have to disclose on a public website detailed pricing information in 3 separate machine readable files. Now, we're going to break this down a little bit and help everybody understand what that means, as well as what do they actually have to do at this point. So the transparency and coverage rules, it's going to be implemented in 3 phases. So the first phase is what everybody's talking about right now, which happened on July 1st. And that phase 1 is to make publicly available these things called machine readable files. They're also referred to as MRF. That detail is important because it has plan information such as in-network rates, allowed amounts for out-of-network charges, negotiated drug prices, and also a whole lot more. So if you haven't noticed, this information has to come directly from the carrier in a lot of these instances because it's not something that the employer is going to have readily available or access to. So many employers are relying on their carriers or third parties to assist them with this requirement. The second phase, which is going to be happening at a later date, is the consumer price transparency tool. And what that's going to be is it's an online shopping tool that's going to allow consumers to see the negotiated rate between their provider and their plan, and as well as be able to obtain a personalized estimate of their out-of-pocket cost for somewhere around 500 or so of the most shoppable items and services. Because again, keep in mind, the whole premise of the rule is to give patients the opportunity to make informed decisions for their health care prior to the treatment. So the third phase, and this is even further out than what we're talking about here in July, phase 3 is requiring shopping tools to show the cost for any remaining procedures. And that could be things like prescriptions, durable medical equipment, and any other item or service that consumers may need that is associated with the care that they were receiving. So the first question that Sara and I have been getting is, well, okay, so this is super confusing, but really, what is the whole purpose of this phase 1 anyway? And why are these machine readable files something that I have to pay attention to? Well, the final transparency rules define machine readable files as a digital representation of data or its information that's in a file. And that file can be imported or read by a computer system for further processing. And the reason that's important is because it removes the human component from the process. So it's happening through the use of technology. So the purpose of phase 1 is really to make this information available to third parties, such as research firms, actuarial firms, and government agencies, so that they have access to information that then will allow them to comply with the future phases. So phase 2 and phase 3 that I was just mentioning, as well as allowing the agencies to be able to control and actually enforce compliance of this rule. So this first phase, everything that's happening right now here in July, is really for carrier level funded or self-funded plan sponsors to pay attention to. It really doesn't have any major impact on the fully insured employee So saying that, let's really talk a little bit more about the timeline then, because as I said, plans have to apply by July 1st. So you may have been hearing about this, and you're certainly getting some confirmation and information in the mail or email from your carrier. So the question that's on everyone's mind is, I heard that this was delayed, but now you're telling me it's in place on July 1st. So Sara, why do you think people have to pay attention to this, and when do they have to pay attention?
So you're right that the effective date was first delayed, but now the rule is in full effect. So for groups with July 1 effective dates, this means that they should already be complying as of July 1st of this year. For groups with effective dates after July 1st, they have a little extra time. They really have to start complying on their actual effective date, meaning when their plan year starts. So if your group renews on October 1st, that's the date they should have the link on their website and be up and running, or at the very least be ready to comply with these rules, whatever that means for this group. And for groups with effective dates from January to June of this year, you're already late to the game. These groups have to comply by July 1st of this year as well, meaning they should already be complying according to whether they are self-insured, fully insured, or level funded.
So one thing that Sara and I know you and I have been talking a lot about, which is there's a lot of confusion around who's really responsible for phase one. So what do employers really need to know, and what do they have to do right now?
So employers either have to host the link themselves or contract with a third party or their carrier to do so. But it's not necessarily that simple. If a written agreement is in effect and the insurance carrier fails to satisfy the agreement, the transparency and coverage rules provide that the carrier and not the employer's group plan will be considered to have violated the transparency rules. Employers with group health plans should contact their insurance carriers to discuss compliance with these rules. And if an employer contracts with the insurance carrier to satisfy this obligation, the employer has no required obligation to host the files on the employer's website, as far as we know at this time. They're not required to post the link on the employer's website to the carrier's website where the files are hosted. So although the rules say it's suggested for a fully insured employer to post this link, it's not technically required if the carrier is doing so on their behalf. Most important is to have something in writing from the carrier stating that they're complying with the requirements. Unlike the rules specific to fully insured plans, however, in a third party situation, the transparency and coverage rules provide that if the third party fails to satisfy the requirement, the employer's group health plan or the insurance carrier, in the case when an insurance carrier is contracted with the third party to satisfy the insurance carrier's obligation, is considered to have violated the transparency rules. So for this reason, an employer that uses a third party to post the files should try to include indemnification rights against the third party for such failures in its written agreement. And now I know there's been a lot of conversation about this term written agreement. Colleen, what should brokers and employers know about this?
You're right. And I think this is another question that we receive a lot. So, most important thing to note is that the written agreement is to be between the carrier and the employer. And that employer could be fully insured or self funded. But there's no specific format that's really been detailed. However, the written agreement should be between each specific client and the carrier. So, many employer groups, they've likely received some kind of communication directly from the carrier. And this could have been an email blast, and they could even gotten a letter in the mail or something else that appears to be an informal communication. That's really what employers want to be able to keep in a file somewhere, because that really is the agreement. There isn't anything in the rule that states that it has to be this many pages, this long, with this amount of information in that. There's no detail. It's just that there has to be something in writing between these parties that state who is being responsible for complying. So some of these email communications, they actually state that this is the formal communication between the group and the carrier, and that it is serving as the written agreement. Not every single carrier, though, has been that clear, only some of them. So if your clients and employer groups are receiving any kind of communication from the carrier about the transparency and coverage rules, they want to make sure that they hold on to that, put it in a safe place, and refer back to to that at a future date if it is needed. So I know, Sarah, that we've been talking a little bit about self-insured and level funding, and a lot of times I know in our world those terms get used interchangeably, as they should. But to be clear, would you just address one more time how we are talking about level funded in this context?
Absolutely. So for level funded plans specifically, they're going to be treated the same as self-insured plans for transparency and coverage purposes. So level funded employers, especially those in small groups, should be made aware and be ready to comply. So just for those who are wondering, that includes Aetna AFA, All Savers, Cigna level funded products, and any other level funded product an employer group may be using. So now that we've talked a lot about employer responsibilities, Colleen, what are the responsibilities for employers to actually notify their employees?
I think this is a great question because we tend to focus a lot, of course, on what the employer responsibility is. But sometimes when complying with these rules, they have to do something with their participants. But in this instance, we haven't identified that there's really any notice requirement at this time for employers to make this aware or make this information available or make their employees aware that this is happening. So on the participant level, there isn't anything at this time, but I think it's important to note that we really expect something to happen in future guidance. So I guess let's stay tuned for that. But this also brings up the other side of things, which is what is the broker responsibility as it relates to transparency and coverage rule? So there isn't anything for a broker particularly to do, meaning it's not as though the broker has to go and obtain these written agreements from every single carrier and have it in place for every single one of their clients. That communication is going to happen between the carrier and the employer through whatever means they are utilizing to communicate. That's going to be some of the things that Sarah and I have mentioned, such as the email communication or possibly a letter in the mail or something like that. But the broker really has an obligation, as we always do in our world, is to just make our clients aware of what is happening and to be able to provide education. So that simply is just letting employers know that you might be receiving this information via email from your carrier, and the information is simply something as simple as we are complying with the transparency and coverage rules on your behalf because you are a fully insured employer, and the broker may want to communicate to their clients, just keep a record of that someplace and put it in a safe place. But a broker doesn't have a responsibility to go and find all of these links for their clients and create any special notice or disclosure requirement for that. There is nothing in the rules that state that. So, Sarah, how about we shift gears a little bit and let's talk about how and where these machine readable files that are in phase one have to be located on a website. So, we know that the transparency and coverage rule applies to all employers, and you were just including and clarifying that that means fully insured, level funded, and self funded. But would you address the questions that we've got about where to actually post this information on a website if somebody has to do so?
Yes. So the first question I get a lot is, what if I don't have a website? So for self-insured and level funded employers, the link must be posted, so a website will have to be created. For fully insured employers, as long as the employer contracts with the carrier to satisfy the requirements, they don't really have an obligation to create a website. But for those of you who do have to create a website, you may have to get creative at establishing some kind of online presence.
I think that's really important because if depending on the mechanism or the website that's being used, it's got to be publicly available. So you got to be super careful not to require any kind of a login. So that's a great point. But I also, Sarah, like one of the other things I know we've talked about is that most businesses create websites really for advertising purposes, meaning they're advertising their businesses and services that are available to the public. So, what do you think about that?
You're right, and that's why it's confusing. And on the surface, it doesn't really make a lot of sense. So I know your website might be for just advertising your business, and this certainly doesn't seem like it's part of that. But it is part of the requirements under the transparency and coverage rules. So the link has to be posted on the website for employees, dependents, and potential interested parties. So we suggest taking a look at your website, whether it's in the footer, in the About Us section, or somewhere else, just as long as the link is easily accessible to the public without logging in. And keep in mind, this is most relevant and critical for self-funded and level-funded employers. And to reiterate, for fully insured employers, you're not technically required to post the link on your website, but it is suggested that you do so. And another question I get a lot is, does this link have to be anywhere specific on the website? There's really no specific place that the link has to be posted, just that it shouldn't be made intentionally difficult to find. And in addition, like we said, no login can be required to access the machine readable files.
Awesome. Thanks, Sarah. I know that this is a daily topic that all of us are talking about, and you're certainly fielding a lot of questions, as I am and the rest of the team. So thanks for taking the time talking with me today. I appreciate it. So the last thing that I wanted to just touch on for everybody is we've certainly covered a lot of information in the short time that Sarah and I have been talking today, and there's a lot more to come. So to help you understand the rule and the phases of implementation, Savoy has created a dedicated resource page where we have housed links to various carrier communications. And one of those links is regarding this particular topic, but it also includes links to the files for these carriers. So if you are one of these plans that is self-insured and that includes level funding and you're trying to find some information, definitely be sure to check out the information that we've made available on the page. As always, should you have any other questions, please reach out to your dedicated Savoy team and continue to use all of the resources that are available on our website, and that is at savoyassociates.com. From all of us at Savoy, stay healthy and safe. Thank you for joining us today.